I'm a second year physical medicine rehabilitation resident. I got involved with Smart University last year, my intern year, and it has shaped so much of what I practice because it makes you remember that there's such a big preventative part to a lot of the diseases that we treat. And while medicine plays a huge role in treatment, what we learn in residency, prevention is just as important. To keep you guys at the hospital is my goal. And while I love seeing you here, I'd rather you implement strategies so that you don't have to come here. We're going to be talking a little bit about pulmonary rehabilitation for COVID-19. Some of the symptoms of COVID are a bunch of pulmonary symptoms, but some of the other ones are fever and chills, the sore throat, the fatigue, the brain fog. That's also a long COVID symptom, the shortness of breath, the stuffy nose, the change in sense of smell or taste, headache and body ache, and then abdominal symptoms too. Every strain, I feel like every year you see one of the symptoms coming out a little bit more than the others. For some reason in the hospital this year, I've seen a lot more cough and a lot more respiratory symptoms. I think last year was a little bit more abdominal symptoms. So it's interesting to see how they've changed, but nonetheless, cough is a really big part, sore throat, and the shortness of breath and the stuffy nose. So that's a little bit about why I'm focusing on the respiratory symptoms. I'm going to talk about pulmonary rehab. Pulmonary is just another word for your lungs and your respiratory system. So the way that we breathe. When you're coughing for such a prolonged period of time, it has lasting effects on how you feel. And when your throat is sore, it's harder to talk, it's harder to breathe. For those of us that have had COVID, I knew I had COVID because I was walking up a hill and I was like, oh my God, I'm so out of breath. And that actually persisted for a long time. I'm a big runner. But after I got infected, it took me a really long time to get back into it just because my lung capacity was so much less than what it used to be. So some of these effects do last a long time. One thing that I found that was really interesting was that 1 in 5 adults over the age of 18 have symptoms of long COVID. So they have a health condition that might be related to their previous COVID-19 illness. And it can be neurological and mental health conditions. It can be kidney failure. It can be cardio. It can be heart problems. It can be blood clots. It can be musculoskeletal conditions. But it can also be respiratory symptoms. The reason that I share this is because sometimes when you get infected with COVID, these respiratory symptoms kind of last a long time. Like that dry cough can last a long time. And usually with COVID, it's more of a dry cough than a wet cough. But some of this stuff lasts a pretty long time. I want to talk about ways to mitigate this. As with any muscle, when you tear an ACL or you strain your bicep muscle, you have to go to physical therapy, you have to go to occupational therapy because you want to get that muscle stronger. After it's been through an injury, you need to give it a little bit more love, a little bit more attention to make it feel stronger. I tore my ACL, so I'm going to give that example. But it's applied to any muscle group and it's applied to the lungs too. Your heart is a muscle too. So those are muscle groups. And after your lungs have been under such a big stress after I tore my ACL, I went to physical therapy for 3 months. I did prehab, I did post-hab, so much stuff to get that leg stronger. And still my left leg is a bit smaller than my right leg. But the same thing with our lungs. COVID comes in, it's transmitted respiratorily. So when you are infected, it's respiratory droplets that will go into your nose and throat and it'll infect your lungs. And within your lungs, it'll cause lasting changes in your lungs. So after the infection is cleared, your lungs have been under so much stress and it's like a muscle being worked too hard. You really ran a marathon. When you run a marathon, you got to take care of your body afterwards. When you get COVID, you got to take care of your lungs afterwards. So we're going to talk about some exercises to help strengthen your lungs, to help release some of that tension. It's just like when you stretch out your arm, you help release some of the muscle bellies, you stretch out the arm. With your lungs, there are things that we can do to help release that tightness and that clogging and that mucus that builds up in your lungs because COVID causes changes in your lungs. Your lungs are little air sacs. And when you get infected, the air sacs collapse a little bit. So we do these exercises to help open up those air sacs and allow you to breathe a little bit better. But we want to get those air sacs open again. And so these are some of the rehabilitation exercises. So the first thing, and one of the biggest things that is really cool, it's called chest PT. So just like we have physical therapy for our legs, occupational therapy for our arms, we have chest PT for our chest. And it can be done at home. It can be done by a physical therapist. It can be done by even a chiropractor or a respiratory therapist. So basically you have the patient sitting or the person who has COVID sitting up flat, and you can have any of your friends or family do it. And sometimes if you are looking at the spine or with chiropractor, there's a lot of things that you can do that'll mess up the back. But chest PT, it's really hard to mess up. And even if you mess up a little bit, it's okay because you're not harming anything. So really what the therapist over here is doing is she's picking different spots on this person's back. So when you go to the doctor to get your lungs listened to, they always listen to spots on the front, but they also listen to spots on the back because your lungs are on your back. And a lot of time with patients, especially with females, fields. In the front, you got some stuff that are blocking access to your lungs. Your breasts are blocking your lungs. However, in the back, you get direct access to your lungs. So when you're physically stimulating your lung fields and your lung muscles and the tissues of your lungs, that's helping to break up the mucus. And if there's a lung sac that's a little circle, it's clogged up. If you're stimulating it, you're causing the muscle to wake up a little bit. You're causing it to stretch out. You're allowing it to open. So like with a muscle, we talked about how muscles get sore, they get fatigued. And with COVID, what happens is your sacs collapse a little bit and they're not breathing as much and they're not working as much. So there's a little bit of lung atrophy, so a little bit of weakening of the tissue. So we want to strengthen that tissue. We want to open it up. By doing chest PT, you're causing that muscle to be stimulated. You're not doing it anymore. You're not punching somebody's back. But that's why if you notice, the woman, her hands are clasped and she's going like this onto the person's back. So your fingers are pretty gentle. If you're going like that, that's going to hurt. But if you're going like that, it's very hard to cause any damage. It's not painful and it's causing a little bit of stimulation in the beginning, especially with somebody who's like really congested or just getting over COVID. It might be not the most comfortable, but it's like a massage. Initially, first you're like, oh, that feels funny. But then the muscle starts to release and you're starting to open up those lung tissues again. So she's going in quick succession and these are the lower lung fields. If she goes a little higher, those will be the upper lung fields. And then you do the right and the left side because you got two lungs. So you want to make sure that you're breaking up the secretions in both lungs. So that's what chest PT looks like a little bit.
When you're doing that, would you expect the person to like cough? Is there anything you should expect in terms of a response from the person?
It really depends. COVID can cause a dry cough, but it can also cause a wet cough. So if it's a wet cough and if it's closer to infection, that's when I've seen more of a cough. If you don't get a cough, it doesn't mean it's not working. Gotcha. But if you do get a cough, it doesn't also mean that it is working. So it's not 100%
indicative of anything in particular.
No. Oftentimes the patient will cough because they're breaking up those secretions. It's exciting when you see somebody secrete a whole bunch of stuff after you do chest PT, but that's usually with like pneumonias and bacterial infections because that's a lot more mucousy. COVID is a little bit less mucousy. So they might have some more watery secretion, but even if you don't get the watery secretions, doesn't mean you're doing it wrong. The lung fields over here are congested and then you kind of dislodge the secretions when you're doing the chest PT. It does work for any kind of congestion. However, I will say that this is more after COVID. While you have COVID, this might be really uncomfortable and COVID is more of a dry cough. There's a lot less secretions. When you're actively fighting the flu, you might be super uncomfortable. So it might be hard for you to lay flat because for chest PT, you either lay flat or you're sitting up straight. So if you're laying flat, especially if you have like a lot of mucus building up, it might be harder to breathe. So as with any therapy you do, every person is different. It's really important with any kind of therapy, do it as tolerated. So if somebody can tolerate more intense therapy, you do it more intensely. If somebody can't tolerate that intensity, you got to be a little bit less intense. It's really an individualized basis. With COVID, the thing is that after you're done getting COVID, you're not actively infected again. And with long COVID, you still have a lot of those secretions that are there, but they're a lot less. And so you're just trying to break that up. Sometimes when you're acutely infected, it's hard to do. It's like when you first tear the knee, you got to wait a week before you go to therapy because it takes a little bit of time for just the swelling to go down and for the acute inflammatory response to subside before any therapy is effective. So if you are going to physical therapy and you are an elderly person or you have a pre-existing injury, obviously you can't do the same exercises that somebody who doesn't have that will. So this is for the patient that got COVID, was totally healthy before. This is after COVID, we're trying to do chest PT. If you are an asthmatic, you got COVID, you're going in with a pre-existing break, like you had a knee replacement. You gotta be a little bit more careful with stuff like this. If it's hurting you and it's causing more harm than good, don't do it. The chest PT is one, and then on the right, I have another diagram, and it's just showing different positional changes. So with chest PT, you can do it either sitting up and you're doing it, or you can do it lying down, and so you're flat on your stomach and you're doing it. But another thing, again, we talked about these alveolar sacs, so the lung sacs, the little balls being collapsed and being plugged with secretions. And so when you're moving around positionally wise, it's the same thing as stretching a leg or an arm. You're stretching out your lungs, you're stretching out those sacs. So for some people, it might be really therapeutic. COVID has affected your lower lung. If you're lying back, it might help break up some of those secretions. But if COVID affected your upper lung, if you crouch over, it might help open up some of those sacs. So these are just different positions that you can take as part of physical therapy for your lungs. You can try lying down on your stomach. If you're lying on your right side on your stomach, pushing your left side back just to open up that lung field. So you're opening up your chest like that. Some people can close off their chest like that and they're opening up the posterior fields of your lungs. Then if you're bending down and opening from the shoulders, you're opening up the upper lung fields. If you're crouching down and going forward, you're opening up the posterior lower lung fields. So a bunch of different positions. It really is dependent on each patient, and it's dependent on what works best for you. Some people like pool therapy when they hurt their knee. Some people hate pool therapy. And so it's really dependent, but these are just different tools that you can use. And another thing that I thought was really cool is see how this person in the picture has pillows. So you can put pillows in different spots to help change your position. And I know it seems weird, but sometimes a pillow underneath your knees can help you move your chest and open that up a little bit. And especially with patients that are elderly, it's a little bit more comfortable, but also to like elevate your legs, but also to just open up your lung field a little bit more. You can focus on your torso, and you're not limited in range of motion of your torso by the range of motion in your legs, because you're keeping those stationary by keeping them on a towel. And so even with going on one side, if you have a towel on this side and you're opening up your lung fields from that side, that might help. And sometimes our respiratory therapists will use a band. So you can even use a band, and it's those like elastic bands that they give you in therapy to help opening up your lungs field. But if you don't have a band, you can use a towel too. I have my jacket. You can use your jacket and the sleeves of your jacket to force yourself to stretch back as far as you can. We don't realize how much we spend of our day slouching over, typing on a computer desk, and that's causing these symptoms of long COVID to persist even more because you're keeping those lung fields kind of squished up. We want to open everything up. We want to increase blood flow. We want to increase the air that's coming in and out of our lungs. So that's chest PT. The next method that we have is controlled breathing. There's a lot of different things that force you to open up your lungs more. We always say like swimmers have a higher lung capacity because they have to breathe underwater for so much longer. But part of the things that they do is they learn exercises to gain better control of their breath and to increase their breathing capacity. And one of the biggest things is to reduce blood pressure and to help with long COVID after and to help with breathing is deep breathing. I know when I'm taking like a long exam, I do that just for myself to regulate my blood pressure, to calm me down, to help relax me. But I didn't know that it actually helps you learn to breathe. I beat my brother all the time in those competitions where we held our breath underwater, and I attribute it to the deep breathing exercises. So it's super effective, and it's these little things that we don't even realize. And to make it a little bit more fun, I saw this thing on music guided breathing. So like for 3 beats of the song, you hold your breath, and then for the next 3 beats, you slowly exhale, and then you inhale for 3 beats and exhale for 3 beats. And obviously, like, don't hold your breath for too long, so it's important. But when we're breathing, to make sure that we're breathing appropriately, your diaphragm sits right here. When you breathe in, your tummy expands and you'll feel it against your hands. And then when you breathe out, your tummy kind of goes in and you're breathing out. So you want to practice breathing in and out through your nose. But when you have COVID and after, it's hard to breathe in and out through your nose. So you have to retrain, and you start mouth breathing. And that's why when you fall asleep, you slobber. But you got to retrain your body to breathe in through your nose. And that takes time. So sometimes you start slowly by breathing in through your nose and breathing out through your mouth, and breathing in through your nose and breathing out through your mouth. But it takes time. So another thing that you can do is you can hold the nostril and you can breathe in and out through one nostril, then switch and breathe in and out through the other nostril. That's a pretty effective way to help breathing and to control your breath a little bit more. But the symptoms of long COVID, the coughing, breathing problems, the respiratory issues, the loss of smell or change in taste, the trouble sleeping, brain fog, mood changes, and to know that you are not alone in this. 20% of the population has this. This is something that a lot of people have, and I know that sometimes it's frustrating, but we are developing new things to help combat this. We are getting more and more equipped at handling this. And the biggest way to avoid this is to avoid COVID. And the biggest thing to do that is to get vaccinated.